Hi, everybody. I'm Shane Bayless, Doc Hockey for Pro Action Sports Injury Clinic. As you can see below my name, it says soft tissue specialist. We specialize in adhesion, breaking it down, muscles, ligaments, nerves, fascia, between muscles, anywhere else you can find adhesion that's basically causing an inflexibility and a weakness in through the body. I'm also a chiropractor by trade, so insurance-wise, that's what people put me under. There's a lot of times I don't do adjustments with people. We just do a lot of soft tissue things, so that's my specialty. We do the adjustments, though, for the people that need it. So Proactive Sports Injury Clinic is where we're located at 308 Palladium Drive, Suite 103. So we're not at the big Senators rink, but we're right below the Terry Fox and on Palladium there, right beside the Marriott Inn and Suites. A little bit about my family. I have a daughter, Sawyer, who's 3.5. I have Max, who's 1, gets into everything. And I have a beautiful wife, Jennifer. She's actually an animal chiropractor. So she does all the stuff that I don't want to do. She's always asked me, oh, do you want to do animals with me? I could use the help. And I'm just like, I'm good, animals aren't my thing, and I'm pretty sure they would bite me every time I got close to them. So I'm pretty happy dealing with people that can talk to me, tell me where the pain's coming from, and any other details to their case that can be helpful. So today's topic is telehealth. And, there's a lot of, I think, confusion about it, and hopefully we can clear up some of that and why it can be helpful for people. So what is telehealth? It's like a Skype style, Zoom, FaceTime. You can even do things, WhatsApp, to-go meetings, those types of things that are, virtual video, seeing the doctor. It's been created for anyone who cannot make it to the clinic or in this time of crisis where COVID, we're forbidden to really see people one-on-one or in person. How does telemedicine or telehealth work? So there's me and the computer coming out at you. Can be a little bit scary because, you can't just turn away. I'm always there, but it's awesome. And you can see our patient is either on his laptop or other devices, and we'll get into that. So telehealth, it's a virtual visit. Always remain circumstances where an in-person visit is required, but obviously the research also has said that virtual visits can be just as beneficial as some of the in-person visits going forward. So in the future, this might become more and more common. Services via telehealth. So we can do troubleshooting in your first consultation for any neuromuscular kind of conditions. So sprains, strains, any pain, movement problems, concussion, and lots of other assessments that we can do. We do exercise education, and we can create programs for them as well. Nutritional advice, concussion rehab are just some of the things that we can do over telehealth. How does this work? All you need is an internet connection and a laptop, a desktop, a smartphone, an iPad, anything along those lines that you can produce a video on. So having a webcam is kind of important as well, so we can see each other, or else we're just kind of talking on the phone. Consent form, we have a link in the email that says, yes, I consent to having, a teleconference, because obviously it's over the internet. There has been things about people getting hijacked on Zoom and things like that. So it is appropriate that you confirm that it's okay to have this type of appointment. Doing it over Google Chrome seems to be the best way to do that, especially with our platform, which is Jane app, which does our scheduling, our billing, all that stuff is pretty secure when we're using Google Chrome, and it doesn't have many glitches something like Safari might have, or Internet Explorer. And we usually give a summary after the appointment as well. So the summary would be, what we did for exercise, what we have discussed during the appointment. Sometimes it's needed and sometimes it's not, because if you know how to do the exercise, we might not have to do that. All right, so with telehealth, we offer virtual appointments for convenience. So easy to get to. Elimination of travel time. As we know, in Ottawa, there's a lot of rush hour traffic, and you might not want to have an appointment there, especially if you have to leave an hour earlier to do that. It might be easier to do it out of the home. And if you can do that, then obviously it might be beneficial to you. Assessment in the comfort of your own home. So, it can be a lot comfortable. You don't have to get dressed up. Other people aren't going to see you. The joke with Zoom is, am I wearing pants? And the answer is, no, I'm wearing shorts. But anyways, it's something a little bit more easier to do at home. Sometimes you feel a little more comfortable. You can show me different things if you fell off the stairs, or if you has something you want to use for equipment, or anything that you have that is at home. It might be a little bit different than just describing it online. And to the side, obviously, we have the things that we can use, but it's a secure technology because we're using Jane app. And it's really easy to use. We send you an email, you click on yes, begin appointment, and you come right up into the telehealth onto our video page, and we just start talking from there. I do have a patient that, for some reason, when she goes into the email, she just doesn't click on it. She has to get her daughter to do it. She's not, really old, and she uses a computer. She uses actually on her phone, but she just struggles with it. So I always help her out and just say, press the link. But most people grab onto it pretty quickly, and it's not a problem. So there's not a lot of time wasting. So if you do have a problems with computers or making sure your microphone works, it's a good idea to kind of set up an appointment 5 minutes early to make sure all the glitches are out and people can hear you and see you. I think everyone knows about Zoom, and make sure you unmute yourself so that you can hear everybody. And if you want to not be heard, you know how to put it back on. All right, thanks. All right, so what are more benefits? It's a decreased cost to most of our patients. We do about $45 for follow-up appointments. We haven't done consultations payment-wise, but we will be discussing that in the future coming up. But it will be a discounted rate for the other for that type of appointment. Improved access to care. So if your scheduling doesn't work for that, we can probably schedule a after hours even appointment, or just using access to care at your office, in your car, anywhere that you have your phone available or you're able to get online can be something really easy for you to do. This might change future of healthcare appointments. I know CHIO's doing things, I'll mention that later on, but they're the first child's hospital to actually do telehealth appointments, which is really great for Ottawa people, since we're having that access, and we always hear about the lineups in emergencies and at these child's hospitals. So this might be a really great thing to decrease those type of waiting times and really get the people that need to have hands-on treatment to be there. Research. So the research, there's a BC study that found 79% of patients who had a virtual visit said the quality of care was the same as in person. That's really exciting, since people are always worried about not getting their bang for the buck or to get better during these visits. So you got to participate. The other research is that telehealth rehabilitation is effective to improve physical function. So, what's what we're working on? Musculoskeletal conditions, your performance, your ability to do everyday activities, those are pretty important. So seeing that the improvement of that is available, doing these types of protocols, that's excellent. It's also more favorable than just a usual care appointment. So just doing personal appointments in person, they say better follow-ups when you're having telehealth as well as those normal appointments really do patients better. Then later on, it says solely via telerehabilitation, face-to-face is just as important, and you see improvement, even improvement in pain, which has been comparable to other interventions from other colleagues and professions. So the differences in person appointments versus appointments over telehealth. So the arrows are challenges, and the stars are what we can do observable. Okay, so exact values. So the knee to chest exercise, which, you're just bringing your knee up towards your chest like so. You can do this by yourself, and, you can say, oh, I'm 2 fingers away from my ribs, along those lines. Neck rotation, if you're, facing away and you're turning your head all the way top. I can take a ballpark position as long as you're in the right posture for me and you're not doing any cheating, which we can see on video because we can see you. All right. You might need to get a helper. We often say, let's get a helper with certain things, muscle testing. So if I have my arm up and I'm pushing down, you might need a partner to do that because you might not be a person that wants to engage that muscle at that moment. And you might do different pressures for different structures or different muscles. And we don't want to do that. SLR stands for straight leg raise. So you can do it lying on your back, bringing the legs straight up, right? But that's more of an active straight leg raise. And the active and passive are usually at different degrees or different abilities to move. Having a patient do that, or a person with you, like a partner, mom, dad, sister, is usually more accurate, and we can ballpark that as well. But the exact degrees, if you're measuring that, say, with an inclinometer, can be a little bit more difficult than it is in the office. Where patients are having pain and touching the certain elements of ligament, joint, muscle, that can be a little bit challenging, but as long as you're giving good descriptions of where you want them to go, it's usually not that bad to do. And plus we can have, that partner doing it as well. Now, vestibular stuff, which is basically balance, and head movements and eye coordination with balance, can sometimes be a little bit more difficult, but we have been able to do a lot of that. The head shake test, where the practitioner has your head and you're moving it back and forth and then quickly turns it, getting you to stare at a target, sometimes is a little bit harder to reproduce, and I don't think you can do that at all, as I've been talking to some other clinicians that have done this test. Midline shift is usually when you're bringing it down. Is it in the middle? Is it in the middle? People with concussions often can have this disability where they don't see where central is. Range of motion can still be done. You're just going to have to ballpark it. Exact values might be harder, but it's definitely doable. Posture, walking, function, movements, exercise. I can see all that on the video, so it's not a problem. We can assess that part of it just like we do in a regular assessment. Eye movements, if I'm looking at going back and forth with fingers, back and forth with the eyes, near point convergence, we can do that from the side and look at it, or even have them kind of measure it with a ruler. Not usually that difficult to do. We can do smooth pursuits, following it, how they go around, H patterns, hold fixations. All that different stuff that we do for concussion testing is definitely available over online. All right, load management, huge thing that we do in our practice as well as online. It's easy to do that. Obviously, we want to have not more load than our body can take, so the capacity to do work is our load sufficient to perform those activities without injuring us further. So strategies to be used to get better. So we have load management. So we're looking at load management. We're looking at proper posture, all right? Making sure that you're taking the load off the damaged postures and you're in a good position so that you're not overloading the joints that are not working well. All right, we have things to avoid, so exercises, or if I'm standing over a kitchen sink and I'm leaning forward and I have a bad back, that might not be too good for the ligaments or the discs in the back. You might want to be more standing up straight. Exercise, good and bad. I often get that going. What about squats? Can I do squats? Can I do planks? Can I do that 15-mile run? Maybe not. And then we can do modifications. Maybe you can't run, but we can do something else like the Stairmaster, or something easier on you, like swimming or biking. Those things might be a lot easier to do for you than doing a run or even a walk, just because you're not having that bouncing effect and having to absorb those types of forces through the body. Bracing, all right? So we often talk about bracing too. We can talk about bracing going, is a compression brace okay for my elbow, or do I need to have that strap that goes across to relieve the pain off the outside part of the elbow or the inside part, creating a new insertion point where the stress is being focused. So sometimes they have those questions, and those things can be load management as well. Exercise and advice, all right? So sequence of exercise, the progression, usually an isometric to a concentric, which is shortening of the muscle, to an eccentric, which is basically lengthening under contraction of the muscle, which is the hardest load on the body. Safety and technique, how you do the exercise, the safety of it, maybe not going as low with the squat, and making sure that you're not dipping in the back with maybe a plank. Exercise and stability often takes pain downwards, so you're not feeling as much pain when you're having the stable structures. If you have that weakness, we want to balance those out and do that with exercise. And we can definitely do that over Zoom or telehealth. Self-massage techniques. Sometimes I get people to do some self-massage into the neck to open up those joints, let the inflammation out, as well as decreasing the tension in the muscles. Because once you put pressure on it, usually they relax and you're doing a lot better. So why not telehealth, right? So the challenges are, in-person appointments are not necessary. You need to know that part of it. A lot of people are just in trance going, if I don't see you and I get hands-on treatment, I can't get better. It's not true. 90% of health is what you do at home, not what you see the clinic for, because you're not seeing them that often. You're more at home and doing your everyday activities. So make sure you're doing that. You got to believe in your practitioners that they're doing a good job and they're actually trying to help you out. We have mentors for business coaches, sports coaches, all that stuff, advice and strategies that we can use that you might not be aware of to help you get better. But we may need that motivation to do those strategies at home. Telehealth is becoming easier and more important, and we need to make sure you're making that appointment, all right? You gotta, take that leap of faith sometimes and just ask that doctor, maybe I need to see you, at least talk to you and get you through that. It can be for mental health, it can be for psychological, or it can give you for those exercises that you've been missing in your program. All right. This is just becoming more convenient. It's faster. It's more cost efficient. And I think a lot of professions, from medical doctors to physiotherapists to chiropractors, are realizing this now. So I hope you learned something today. Remember, improve yourself with telehealth. Thank you.